Today we're covering cardiovascular system and we're looking at histology, a microscope slide of an artery and vein. When we cover cardiovascular system, we look at three different microscope slides. First, the cardiac muscle of the heart, our pump. Then we focus today on histology of the vessels, our artery and vein, and then blood smear, the fluid, which is our connective tissue fluid, our blood. But right now, let's focus on the difference between an artery and a vein. First, functionality. Remember, an artery takes blood away from the heart. I remember that the letter A is in artery, and in a way, the letter A is in a way. So A for A, that arteries take blood away from the heart. Veins bring blood back to the heart. And what we typically have is an artery and a vein that run together, along with, you can see some of nervous tissue, so some of the nerve as well. So when we look at a cadaver, we tend to see that artery, veins, and nerves all run together. And sometimes their names are very similar because it's based on their functionality and where their landmarks are in the body. When we look at an artery versus a vein, an artery tends to hold its shape like a nice circle relative to a vein. And I picked a slide picture here that shows this very well. An artery, identifying first the vessel, is knowing just how it holds its shape. An artery has more pressure. It has more muscle tissue to it, specifically smooth muscle that we see in the middle portion of the vessel. It has more elasticity with elastic fibers to allow for it to maintain its shape. So because of that pressure to get all of that blood flow that has now oxygen in it, it's going to maintain more structural integrity of the pipe. So when I see a nice circle relative to something like a vein will collapse if it doesn't have blood inside of it. So I have artery and vein based on just the structural integrity. And then we have three layers of each. Where I have the blood touching, this first layer is called tunica interna or tunica intima. Remember, tunic or tunica is referring to a layer. And it's just this small little ribbon here. So this small little dark ribbon that you see is tunica intima. It's intimate with the blood. Or tunica interna. So you'll see either term intima or interna. This type of tissue is simple squamous epithelium. So we start to see you actually have three types of tissues in our vessels. First, starting with an epithelial tissue, and there'll be a basement membrane of connective tissue underneath to stabilize it. But this first layer, tunica intima. So if I just go where the blood would touch on the vein, this would be tunica intima or tunica interna. Next, I just look for a change. So I have that dark ribbon, and then from there is my muscle portion of it. Three types of muscle in the body: skeletal, cardiac, and smooth. This is not my skeleton, it's not my heart, so this is smooth muscle. I don't have control of how I'm going to pump the blood through my body. So this portion here is tunica media in the middle. Tunica media, and tunica media is that muscle layer, specifically smooth muscle. So I just go deep to that. Underneath, this is now tunica media. So smaller with the vein. Remember, we said the vein is actually going to rely on different mechanisms to move the blood, but we have less of the actual muscle tissue. And then towards the outside, and I just again look for a change knowing my order. So you can see that smooth muscle appearance, but then as I get to this darker pink, this is tunica externa, also called tunica adventitia. So tunica externa or tunica adventitia. And then this is connective tissue. So I have epithelial tissue, muscle tissue, and connective tissue. So you start to see a trend through the whole body that we use the different types. And then I have nervous tissue on this side. And then you can see a lot of these little bubbles these are adipocytes. This is adipose tissue to support all the vessels. So in review, arteries take blood away from the heart. They hold a nice shaped circle relative to a vein. And a vein has the same three layers. They're just not as prominent, although you will see a thicker tunica adventitia sometimes with a vein. So I have tunica interna or intima, tunica media, and then tunica externa. This is histology of an artery and a vein.